ambulance service in the UK plays a vital role in providing emergency medical care to those in need. In 2020, the ambulance service received over 10 million emergency calls in England alone. According to the latest data from the NHS, the most common types of 999 call received by the ambulance service related to medical emergencies. In 2020, medical emergencies accounted for over 75% of all 999 calls received by the ambulance service. These types of calls included cardiac arrest, strokes and difficulty in breathing. Other common reasons for calling 999 to the ambulance service include falls, road traffic accidents and injuries from violence. Falls accounted for around 10% of all 999 calls, while road traffic incidents and injuries from violence accounted for around 3% each. The COVID-19 pandemic also had an impact on the types of 999 calls received by the ambulance service. In 2020, there was a significant increase in the number of calls related to COVID-19. These types of calls accounted for around 8% of all 999 calls received by the ambulance service in 2020. In addition to responding to emergencies, the ambulance service also plays a key role in providing non-emergency patient transport services. This includes transporting patients to and from hospital appointments and transfers between hospitals. Non-emergency patient transport accounted for around 10% of all ambulance service call-outs in 2020.